My Lords, all supplementary questions have been asked, and we now move to the next question. Lord Cashman.
My Lords, I beg leave to ask the question standing in my name on the order paper and recall that I am a member of the APPG on AIDS and HIV and a patron of the Terence Higgins Trust.
Minister, Lord Kamal.
Thank you. The Government remains committed to reaching zero new HIV transmissions in England by 2030, and we continue to make good progress towards this target. In September, the Government committed £36 billion over the next 3 years for the NHS and social care, but decisions on future funding for non-NHS and social care budgets, including for the new HIV Action Plan, are being taken as part of the comprehensive spending review.
Ashman.
I thank the Noble Lord the Minister for the response, and he hits the nail right on the head, because he will be aware of concerns by NGOs, the Elton John AIDS Foundation, the National AIDS Trust, the Terence Higgins Trust, that the Government will actually commit back down on its financial commitments to AIDS and HIV. And we need greater commitment to ending transmissions now, not less. Therefore, will the Noble Lord the Minister ensure that the Government keeps its commitments made at the height of the COVID pandemic in December 2020 by the Chancellor to end new HIV transmissions by 2030? And will he further commit to implement opt-out HIV testing in high incidence areas in England?
Can I start by paying tribute to the Noble Lord Cashman? We served in the European Parliament together for many years, and he was always a champion of LGBTQ+ issues, but also made sure that people were aware of the issue of HIV and tackling it. Funding for HIV treatment and care services is provided by NHS England, and improvement through specialised commissioning. Now, HIV testing and prevention is actually funded by local government through the ring-fenced public health grant. And in March 2020, the Government announced that the HIV prevention drug PrEP would be routinely available across England. The public health grant in 21-22 includes £23 million to cover local authority costs of routine and commissioning, and in addition to £11 million made available in 2021. But I give the Noble Lord that statement.
Lord Fowler.
Is not one of the chief challenges for the Government to combat the stigma and prejudice that still surrounds the HIV and AIDS area? And is it therefore not important that there should be a strong public education campaign run by the Government to improve public understanding and to dispel the myths? Surely countering stigma must be a key to ending the HIV epidemic.
My Lords, I'm sure you'll see there is agreement to the point made by the Noble Lord, and as part of the Government's commitment to reaching zero new HIV transmissions in England by 2030, the Department is currently developing a new sexual and reproductive health strategy and an HIV action plan. Officials will continue to engage in discussions with the Department for Education during the development of these publications, and what we do is relate to how HIV is being covered in the statutory curriculum in schools and as part of the intimate and sexual relationships lessons under personal health and social education.
Baroness Merton.
My Lords, HIV can affect anyone, as we know. And despite the success in combating HIV, further reducing the number of people who remain undiagnosed with HIV will become very challenging unless testing uptake is improved, as my noble friend Lord Cashman said. This is particularly the case for heterosexuals who do not consider themselves at risk of HIV. And so what assessment has the Noble Lord the Minister made of why people who visit a sexual health clinic may leave without testing for HIV, and will the Noble Lord the Minister make it a priority to ensure that all those attending sexual health clinics are offered and encouraged to accept an HIV test?
I'm afraid I don't have the detailed answer to the question that the Noble Baroness has asked, but I will commit to write to her.
Virtual contribution from Baroness Brunton.
My Lords, the Minister was right to highlight the fact that sexual health funding, it comes to the public health budgets from local authorities. The Terence Higgins Trust and British Association for Sexual Health and HIV report from 2019 showed that 5 years of cuts to public health and sexual health funding have had a direct impact on access to sexual health services. So can I push the Minister to confirm that there will be a real terms cash increase to fully fund the HIV Action Plan to local authorities' public health budgets for the next 3 years?
I thank the Noble Baroness for her question. The Department is currently developing a new sexual and reproductive health strategy and an HIV Action Plan, as the Noble Baroness referred to. Now, we plan to publish the HIV Action Plan later this year to coincide with World AIDS Day on the 1st of December. And the Action Plan will set out clear actions to achieve the interim target of reaching an 80% reduction in HIV transmissions in England by 2025. Publication of the detailed sexual and reproductive health strategy will follow shortly afterwards.
Lord Lexton.
Do the government accept that the forthcoming action plan should have 4 key features? The expansion of testing, greater support for those living with HIV, increased funding for HIV prevention and new national prevention programmes. Will the government provide sufficient resources to achieve all these 4 aims and so enhance its reputation as a global leader in combating HIV?
I thank my noble friend for his question. The 4 features referred to by my noble friend are aligned with the Independent HIV Commission's recommendations, and the government has welcomed the HIV Commission's report and is currently considering its recommendations to inform the development of the forthcoming HIV Action Plan. Specific decisions regarding resources for the HIV Action Plan are being taken as part of the ongoing comprehensive spending review.
Lord Scriven.
My Lords, over a year and a half ago, Joe Churchill, the previous Parliamentary Under-Secretary of Health, said that the government was seriously considering access to pre-exposure prophylaxis for HIV in community pharmacists and GP practices. Will the Minister say when this will happen, and if not, what's holding it up?
As the Noble Lord says, in March 2020, the government announced that HIV prevention drug PrEP would be routinely available across England in 2020-21, and it's now routinely available in specialist sexual services throughout the country. Now, the settings in which PrEP could be made available outside of these health services, such as pharmacies, will be considered as part of the ongoing work on the development of the sexual and reproductive health strategy and the HIV Action Plan. Now, we plan to publish the HIV Action Plan later this year to coincide with World AIDS Day on the 1st of December and the sexual and reproductive health strategy shortly thereafter.
Virtual contribution from Baroness Masham of Ilton.
My Lords, I welcome the Minister to the fight against HIV/AIDS. Will the Noble Lord agree with me that NHS England, public health, local authorities and voluntary organisations should work together to fight against HIV infection so that it does not become fragmented? Also, because of the coronavirus infection, many people think HIV/AIDS has gone away. My Lords, it has not.
Can I thank the Noble Baroness for reminding us that HIV has not gone away, and this is why the government has an action plan, and all Noble Lords will agree how important it is to tackle HIV and to raise awareness. The government hopes in its plan and strategy to be able to do this as soon as possible, and we remain committed to the goals previously set out.
My Lords, all supplementary questions have been asked, and we now move to the next question.